In terms of our clinical hours in our program, we have a very strong emphasis on this. So we have more clinical placements than any other program in Australia, and clinical hours. And that's really important to us because we think that there is a huge amount to be learnt out in the real world. And we want our graduates to come out with placement experiences that are really broad, and not just sort of the core placements. So we want them to have the cores plus all these extra experiences with pediatrics or sports teams or women's health or men's health, or all sorts of different extra experiences. And we think that really adds to your CV, so that when you apply for jobs, you've got a step up already, compared to other graduates who may have only had 4 or 5 clinical placements. So most of our students will all have orthogeriatric, neurorehabilitation, they'll have musculoskeletal, and they'll have cardiorespiratory placements as their cores, and then we add on top of that. And what we ask our students to do is to put in their preferences. So after they've had those core placements and all of their classroom learning activities, we start saying, what are you interested in? What do you want to do? And we start to try and allocate them off to the placements that they're showing interested in, and where they're interested in, and where they might like to go on and work. So the diversity of placements is great, and whilst most of our placements are in Australia, we also have a number of placements internationally. So in Canada, the US, in Sweden, in the Solomon Islands, we've had placements, and so there's lots of different opportunities for students there. One of the new additions that we've had to our program is the Bond Institute of Health and Sport. We have the Bond University Health and Wellness Clinic, and that clinic's been great. So we have students go on placement here, and they might work with elderly patients. They do some more detailed simulation activities. They're working with young athletes coming in, sometimes pediatric patients, and sometimes patients who have back pain, neck pain, balance problems, etc. And we're really looking to see if we can extend the opportunity for the concussion baseline assessments through that clinic, for our local sporting teams, so that we're providing some extra support to those groups that are fairly local to the clinic. So lots of opportunities there. Our teaching spaces, as I mentioned, in that new building are just second to none, I would say. I've actually never seen, I'm very excited and very proud about them, because I think it's a very rare learning environment for students in physiotherapy programs. So, I've had students come in, you can see that what looks like a real patient in that bed on that slide is actually a very high fidelity simulation doll, and they're able to learn their skills there without risk of feeling like they're going to do harm like they might on placement. Really drill their skills, and then they can go out in placement to do that with their live patients.